lockdowns today. Hamilton had pretty much the same numbers as York and Essex. I'm wondering what the metric was, why Hamilton wasn't moved into a gray zone.
I'll hand that to the Minister of Health.
Well, thanks very much for the question, Randy. That is a situation that is undertaken by the Chief Medical Officer of Health. He takes a look at the data on 2 days a week, and then if the numbers are going up in a particular area, he speaks with the local Medical Officer of Health. He also, to obtain his or her view of the situation and whether they believe they should take stricter measures. They also take a look at the rates of hospitalization, number of people in intensive care, number of people on ventilators, and so on. I know in certain parts of the province, in York Region, for example, the hospitals indicated that they were at the tipping point. So there's a number of factors that have to be considered, and that is why in this situation, York was recommended to go into lockdown. Hamilton, of course, is not there.
Follow up?
Would the restrictive measures on top of the red zone measures that the Chief Medical Officer of Health in Hamilton put in have had anything to do with this decision today?
It's all taken into consideration, but ultimately what Dr. Williams has to look at in consultation with the local medical officer of health is to understand what the level of community transmission is. And then, of course, he will speak to the local medical officer of health about any specific knowledge that he or she has about their local area, where the transmission is happening from. And if there's more specific measures that need to be taken, then that medical officer of health is free to do that because they know their area best.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier and General Hillier. I'm hoping you can talk about some of the security concerns that Minister Jones talked about yesterday. She said that the sites have to be readied and checked out for security reasons. She talked about vaccines on the black market. So are there security risks with these vaccines? Are there threats that they're going to be stolen? What are the security concerns heading into this first rollout?
So I'll pass it over to General Hillier and then over to the Solicitor General after the General.
Laura, thank you for the question. So we've had a security assessment done really from stem to stern, from when we receive the vaccines through to their arrival at the site where we want them to go, through to the vaccination site if that should happen to be different. We've looked at the cyber security of it to ensure that the measures that are needed, the appropriate security measures that are needed, are in place. And what I would say to you is we are comfortable that they are. The sites where the vaccines are going, they're used to handling controlled substances. They're used to providing an appropriate amount of security for the number of people that come through. And with the extra attention that we paid with them to what we are doing, we think we will be ready for Monday and onwards. In fact, we know we will be ready for Monday and onwards with the appropriate level of security. We have not identified specific threats, but they are equivalent to controlled substances in our view, and we want to make sure we look after them appropriately.
Thank you, General Hillier. You know, the truth is that this vaccine is liquid gold at this point. We are getting a very limited supply, and we wanted to make sure that we had done our due diligence to ensure that the sites were ready, protected. There's cybersecurity issues, there's physical security issues that we were monitoring and ensuring and working with our two host hospitals to make sure that they had those protections in place. We're satisfied that they are ready, and we have additional resources available if and when they need it. Thank you.
Follow up?
And General Hillier, just on when the vaccines actually arrive in Canada, so we know they're being shipped through Louisville first. Do you have any concerns that the U.S. might try to prevent them from coming to Canada? And are they all arriving at Pearson and then going out to the other sites in Canada, or are they getting shipped directly from the United States to the specific sites in each province? And is this happening Saturday or Monday? Sorry, I know that's several questions in one. I can repeat myself.
That's
if you
okay,
need me to.
Laura.
Thank you.
We expect the vaccines to arrive on Monday. If they should arrive earlier, we are going to be prepared to pick them up. They are going to arrive at Pearson. We have thought about them moving through the United States from Belgium into Germany, through the United States into Canada, and realize we cannot control what happens from there. So Pfizer has said that they're going to deliver to us by Monday. We've done our planning, our work to be ready for them before that. And then because we expected them on Monday and still do, we are ready to start vaccinations on Tuesday. And can I just come on to that and say, you know, the people that are at the point of the spear for Ontario and Canada in this vaccination program, this light at the end of the tunnel, they're fired up. Let me tell you, I visited both sites, and the people are fired up. They can't wait to start this program because they know how important it is to every single person in this province and in the country. And they're at the point of the spear. They're leading the way on this, and they're fired up for it. We expect the vaccines on Monday. We're going to vaccinate starting Tuesday. If they arrive before that, we'll be ready, but our vaccination program, V-Day, is Tuesday.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi. Question for the Premier from my colleagues in Windsor. The calls for a lockdown in Windsor have been going on for quite a while now. They've had record case numbers. We're told the ICUs are their capacity. How do you respond to the question of whether the province acted fast enough with this lockdown in Windsor, Essex, and what is the province doing to actually help the situation locally there?
Well, before I pass it over to the minister, I just heard through a message through the Mayor of Windsor, Mayor Dilkins, asking to go into lockdown, and I also realized that our Chief Medical Officer was speaking to their local medical officer, and the decision was made. I don't think we've delayed anything, but I'll pass it over to the minister.
Well, thank you. We have been following the situation very closely in all regions across Ontario. And what can happen with this pandemic is all of a sudden, because we are in a precarious situation with the R level being at about 1.1, that it can increase exponentially very, very quickly. And so that's what we're seeing in some parts of Ontario. And so have we acted quickly enough? I would say yes, we have, because both the Chief Medical Officer of Health and the local Medical Officer of Health have been following this closely, and they know when to take action and to preserve our hospital capacity and to prevent further community transmission.
Follow-up?
Yeah, Mr. Elliott, in relation to hospital capacity, the head of the CEO of the University Hospital Network, Kevin Smith, was saying today it's time to lock down a larger area from Oshawa to Niagara up to Barrie, west to London, because healthcare workers can't sustain the demands and the stresses that are on them right now. And we also know that this is a time when the hospitals traditionally get more crowded because of all of the other, illnesses that are happening. So, what do you say to that call for a wider lockdown, given what's been going on with the increase in hospitalizations?
Well, in actual fact, most of the areas are already in lockdown, with one exception, Durham region, and Halton. But it is really important because we have people who are very, very ill in hospitals right now with COVID. There's a very limited number of hospitals that can do the kind of work, ECMO, where you can actually where people can't be on ventilators. It's sort of a super system to deal with that. And we know that there are very, very ill people there that are putting a lot of stress on our frontline healthcare workers. And that's why we need to preserve as much capacity as we can, because we're also trying to conduct the procedures and surgeries that were postponed during wave 1. And they simply can't be postponed again, because there are many people that need life-saving cancer or cardiac surgeries as well. So we have to move forward with this. That's why we have to take the steps that we're taking now. And we've taken steps with 7 public health units this week. And if we have to do more, we will. But we're following the data very, very closely. And we're in close contact as well with the Ontario Hospital Association as well.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Premier, this morning, Prime Minister Justin Trudeau announced a carbon tax that's going to go from the current level of $30 a ton to $170 a ton. Now, you're currently fighting the carbon tax in court, and that case has not yet been decided. When asked, the Prime Minister said that, made a comment about politicians and premiers needing to realize that pollution is no longer free. So a couple of questions. One, your reaction to the carbon tax going up, and do you think that pollution is free, as the Prime Minister says?
Well, you know something, I'm going to separate this from the Prime Minister versus the people. I just can't understand for the life of me why anyone would want to put a burden on the backs of the hardworking people of this province. Folks, this carbon tax is going to be the worst thing you could ever see. It's going to increase the cost of your groceries. It's going to increase the cost of traveling. It's going to increase every good and service you have out there. But not only that, if I were to tell you right now that you're going out tomorrow and you're going to pay 30 cents more a liter on gas, you'd be floored. But it's not tomorrow. It's going to be in 1 year, 2022. You will be paying over 27.6 cents a liter. So the average price, what is it, $1.02? It fluctuates. We saw it a little below $1. Imagine increasing that cost to all the truckers out there, to all the food distributors, and you are going to be holding the burden for what? We can protect the environment. I'm a strong believer of protecting the environment, but you don't have to protect the environment on the backs of the hardworking people of this province and this country at a time that people are barely holding on by their fingernails, and you want to throw a 30% cost of living increase onto the backs of the people that are working, and be it in the factories or the offices. I was floored when I heard this. A matter of fact, I couldn't believe it. I had to double check. And I just don't understand for the life of me why you want us to be uncompetitive when all provinces, we're competing for jobs up here. We're doing everything we can to create an environment for a company and people to thrive and prosper and grow. And all of a sudden, a sledgehammer comes and hits you over the head and says, now you aren't going to be competitive because the federal government's going to make sure we aren't competitive. How can you square that with people's lives? They are hurting. They are hurting so badly right now. The calls I get every day. We worry about shutting down the economy because of COVID to save lives. When we get through this, we're lucky to have jobs. How can I go out and sell Ontario as a competitive environment when we have everyone in the world clamoring at getting jobs and attracting companies? And we've done a phenomenal job at doing this. And all of a sudden, they tie both my hands behind my back and try to encourage companies to employ people. And by the way, you're paying 30% more for everything, not just gas, food, cosmetics, services, restaurants. You want to see restaurants hurt? You want to see small businesses hurt? You slap 30% tax on them. And make no mistake about this is nothing but a 30% tax grab. I've never, ever been more disappointed in an announcement ever since I've been in politics. This I just cannot understand for the life of me.
Follow up?
Yesterday in your meeting, you and every premier across the country, regardless of political stripe, was asking for more funding for healthcare and the Canada Health Transfer. The Prime Minister said no. Then in his news conference talked about how he's open to it. Today, as part of his announcement for the carbon tax, he said they're going to put $15 billion into climate change programs. I want to ask you about the decision to say no to you on Canada Health Transfer while saying $15 billion for his climate change projects. And by the way, why don't you sign on to a new national program for childcare, for pharmacare, and long-term care? Do you buy him when he says that he'll be a partner for you and help pay for it when they're not paying the current health transfer bill.
Well, there's two things, Brian, that are more important to people across the country. And when you see 13 premiers of all different political stripes, from NDP, Liberal, Conservative, all banding together and sticking together on this, two things that are important to people in life. Their health is number one, and having a job to take care of their family and put food on the table is the second one. And we can't sustain the spending that we're doing in healthcare by ourselves. The feds are putting in 22%, and all the rest of the provinces are picking up the balance. How? We just can't sustain it. You want to talk about backlog surgeries, and when we don't have the money, and then they want to put money into something that's not going to save lives or it's going to hurt the economy. I just can't figure it out for the life of me. And the average person sitting at home listening to me, I don't know how they're figuring it out. So we're in desperate, desperate need. All the premiers were begging and pleading, please just come up with a compromise. We're willing to work with you. And it gets shut down, and then we get this announcement today. So you refuse taking care of health care, and then to make it worse, I'm going to put everyone out of work. This is not, folks, I can tell you, this is not political. I don't care if someone's a conservative, liberal, NDP, green, purple, pink party. I don't care. But when it hurts people and hurts people's health care, and the minister's up all night working around the clock with all the docs and the nurses, and then I'm going to tell the docs, oh, by the way, we have no more money for you, and by the way, hospitals, you have to reduce surgeries because we just can't sustain it financially. But the federal government wants to put $15 billion, and God bless the environment, don't get me wrong, it's very, very important. But the folks at home, you tell me, is your health and well-being of your loved ones and yourself and your job and the economy more important than $15 billion on some green scam or whatever the heck it is? No, it's not. We can all be environmentally friendly. We can all, try to reduce emissions, which we are. I don't know a person out there, I don't care what political stripe you're from, that doesn't want to protect the environment. But when we have no economy and we start health, you want to talk about a health crisis. You're going to see a health crisis like you've never seen before across the country. And we need the support of the federal government. We can't sustain it. I'm telling you, we just can't sustain the spending.
Next question.
Your next question comes from Graham Richardson with CTV Ottawa. Please go ahead.
Hi there. Practical question for the general. The vaccine's coming to Ottawa. You're going into Pearson. Are you flying them or driving them to Ottawa?
I'm going to defer. They'll fly into Ottawa without question.
Follow up?
Your answer, I'm sorry.
They will fly into Ottawa.
Follow up,
Okay.
Graham?
And the other question I have on that, 1,500 Toronto, 1,500 Ottawa, how do you choose, is that healthcare workers in the hospitals and then you move out to long-term care homes? How do you choose which long-term care home workers you vaccinate?
It's actually data-driven in the extreme. We've walked through this many times in the last days. However, what we are doing is looking at the long-term care homes that have had COVID-19 so tragically visited upon them, or where they've had challenges and tragedies before, where there is communal living, that is to say a shared kitchen, where there is more than one person sharing a room, and long-term care homes where the provinces had to intervene. Those became the first in the order of priority. Since we cannot move the vaccine, the Pfizer vaccine, to those homes and set up a special vaccination site and vaccinate the residents and all the workers and the healthcare workers and essential visitors, what we're starting with is moving those healthcare workers and the essential visitors from those long-term care homes to the vaccination sites. And as one of the doctors said to me, by doing that alone, we'll improve the protection of the residents in that long-term care home by 90+%, because the COVID-19 enters the home through those people. And so that's what we'll do. It's a data-driven operation, to go after those that are in most vulnerable circumstances first, and then work the rest.
Last question.
Your final question comes from David Akin with Global News. Please go ahead.
Thanks very much. I was very interested to hear General Hillier note that you will be reserving second doses. British Columbia is not. It is maxing out on first doses, and I guess it's been told by someone it'll get a second dose for those within 21 days. Neither is Quebec. It's maxing out on first doses. Neither is Saskatchewan. It's maxing out on first doses. So I'm not sure who's this for, Minister Elliott, Premier Ford, but you've, I guess, been not told that you can go ahead and max out, as BC and Saskatchewan and others are doing, and you'll get your second dose. Or you haven't. I'd like to clear that up while you've taken a very different decision on reserving second doses from other big provinces.
Well, thanks so much for the question. First of all, there are 3,000 doses coming to Toronto, 3,000 going to Ottawa. That's a really small slice of obviously the overall vaccination program that we're going to walk out and deliver for the people of Ontario over these next months. We know that we received advice from Pfizer that we could go ahead and vaccinate 3,000 people with the 3,000 doses here in Toronto, 3,000 in Ottawa, and that the supply would be there at day 21 or thereabouts for the second vaccination. Given the sort of information flow and what we know about the supply, which is very little at this time, and the dates when the next vaccines would arrive, which is 0, and those kinds of things, we decided it is better to err on the side of caution in this smaller case. Vaccinate 1,500 people, guarantee them that we will have the second dose there for 21 days. Do the same in Ottawa, guarantee them we'll have the second dose at 21 days. And then as we move down the road and larger batches of the vaccine arrive and we develop a confidence in the vaccine supply and when it is going to show up, then we would reassess and be prepared, I would think, to go as you just described. But we made our assessment based on the best judgment. We talked to the doctors at both sites last night, and they said, yes, save that second dose for day 21 and plus, just to make sure. So trust but verify is something Ronald Reagan said years ago. That's kind of what we're doing right now.
Follow-up?
Yeah, thank you, General. That's terrific. And I think this is going to be for you, too. So earlier in the week, we heard here in Ottawa from General Fortin that today, more than 100 federal, provincial, healthcare, First Nations partners would be involved in the dry run to see how this Pfizer thing is going to move around. I wonder if you can talk about how that went in Ontario and maybe explain to people a little bit more about the complexity in getting this thing from an airport out to a nurse who's putting it in people's arms. How did the dry run go today?
First of all, I haven't got a back brief on that dry run myself yet. I've been out of the building, so to speak, most of the day. Not only that, here in Ontario, with our task force now and all the people engaged, we are doing a tabletop war game right this moment to walk through the arrival of those first vaccines, how we receive them at the airport, where we're going to actually meet the airplane with them on, who is going to do that, what route we're going to follow to the University Health Network, what route we're going to follow to the Ottawa Hospital, which gate they would go in, who would receive it, where it'll be stored, and then how we're getting out to let the people know that they are going to be ready to be, they will be slotted for Tuesday and what sort of time frame, and arranging all of that then over the weekend for they have the actual vaccination site set up and ready to roll. We've been walking through all of those things, including then how long it'll take us to take the vaccines out of the ultra-low temperature freezers, thaw them, dilute them with the mixture that we have, prepare them in the syringes, and then be prepared to go to vaccinate in the first people that come in. We've been doing all of that. This is the third time we've done that ourselves. We participated in the federal war gaming of it, which really stops by the time their war games really effectively stop when that vaccine is delivered to University Hospital Network and Ottawa Hospital itself. So we take it from there, but we also include the part from the airport.
Thanks, everyone.
Is that it?
Yep.
Well, just a quick note. Folks. You wonder, I think this is 191 press conferences over a 9-month period all over the province. And there's a gentleman that's bringing this to your homes, your living rooms, family rooms, bedrooms, kitchens. And this is Jamie. So Jamie, can you walk from away from the camera? It's Jamie is actually going to go on a well-deserved vacation. I don't know where you're going, Jamie, because you can't leave anywhere, but you're well-deserved. And this gentleman is just absolutely incredible. We'll wait until you get over here. Talk about a true champion. This guy, we all of Ontarians owe a debt of gratitude for Jamie driving around in that van all over the province by himself. So thank you, Jamie. You're amazing.
Thank you. I'm just one tip of the machine. There's so many journalists at home, other people at home, writers, all doing exactly what they did months ago. And I'm just the tip of the iceberg, and they should all be congratulated.
Yeah, well, you know something, I do. All sincerity, you know, I do thank the media. I thank them all the time, even though they rough me up every once in a while, Jamie. I want to thank you guys because you find a lot of stories because everyone knows there's a million moving parts, and sometimes we don't hear about it. And any time you've ever given us a lead, I call it a lead, to go after something, we do. So all the media, thank you very much, and I wish everyone, first of all, happy Hanukkah and Merry Christmas, and hope everyone has a very healthy New Year. But we'll keep coming out until Christmas time.
And
but
I've got
thank
one
you.
more thank you.
Yes.
Thank you to your team. Your team has been amazing. The whole team from the Premier's office and all of the ministries.
Thank you.
They've all been so cooperative and helpful, and it's been a real team effort to get all these press conferences. 191? Wow.
191. Jamie for Premier.
Thanks, everyone.
Okay, thanks, everyone.